If high levels of cortisol decrease the CD8 cells, are there any chemicals that can increase the CD8 cells?
Lori, one time. Go ahead, grab a microphone.
Thanks. So the levels of cortisol that are present in patients and people with a variety of disorders are not the same as the blasting levels that you get for total immune suppression. So there is a potential for checks and balances. So when you talk about stimulating CD8 T cells, it's not like you're trying to bring them back from the grave, so to speak. So there's a lot of substances that stimulate CD8 T cells. For example, cytokines that have been recombinantly produced have been shown to act as growth factor receptors. So you don't really need the CD4 T cells there if you have one of the cytokines that you can infuse that can actually get the CD8 T cells to grow. Like I said before, some of the chemotherapies that we use have been shown to remove that immunosuppression. So the cyclophosphamide, Lisa's Cousins group published a very nice study that demonstrated in patients who were naive to Cytoxan and patients who received Cytoxan in the neoadjuvant setting, not only was there a statistically significant greater infiltrate of CD8 T cells in the Cytoxan-treated group, but the CD8 T cells were also highly functional. They were releasing the enzymes that they use for killing. So I think you have to remember with the immune system, it's all about checks and balances, as Mark said. You're trying to take the seesaw and move it to the way you want. And there's a tremendous amount of agents that are being developed right now, both in small biotech and big pharma, that are really designed to do just that.
Good answer.
Can I just add something to that? On a sort of more naturalistic level, we are also trying to help patients normalize their circadian rhythms of cortisol. It is true that the levels, while they're high, they're physiological levels, but if they're high all the time, that has an effect on the body because there are circadian changes in natural killer cells and other immune cells as well. And so doing what your grandmother told you to do, eat well, sleep well, and get plenty of exercise, is actually good advice for breast cancer patients. And we're finding that patterns of exercise and activity not only lower fat burden, but may also help to normalize these rhythms and result in improved outcome as well. So listening to your grandmother may help also.